We are pushing the limits this morning, and it has a huge payoff for some women.
You're about to find out why we're saying that. Dr. Angela DeRosa is here with some information on the G-spot and a shot that can make it bigger. And then there's also an O-spot shot.
Yes, there is.
Really?
It's for guys like you that have a hard time finding it.
You know, I knew that I shouldn't be sitting between you two.
Yes,
This segment is to help both men and women, by the way.
Well, actually, what's interesting, this whole topic brings back the whole thing, is there really truly a G-spot, and what exactly is the O-spot? Well, the O-spot's really the O-spot for orgasm, and it's supposed to help women obtain orgasm. But the interesting thing is when you look at the two different shots, one is to enlarge the G-spot, which it's always been a mystery to most people, most men, that is, but also the O-spot, which is basically where you inject the clitoris as well as the opening to the vagina, which is supposed to enhance sexual pleasure as well.
This sounds really painful.
Well, apparently you numb the area. Not that I have personal experience with this, but certainly you numb the area and then you inject the areas with what's called a platelet-derived growth factor. They take some of your blood out and they put it in, which stimulates cell growth in that area to enhance and actually make the area larger and supposedly more attainable and sensitive.
This is something a doctor does?
Well, I would certainly hope you wouldn't do this.
Well, you never know. I mean, if some guy's like, hey, if I got a shot for you, run the other way. How long does it last?
Well, it's supposed to last forever, but there are some studies that suggest every 3 to 4 months. But I also want to preface this that, A, if you're going to do this, absolutely make sure you know who's doing it and if they're qualified to do this, because there's a lot of people in medicine that are trying to make a good fast dollar. So you have to be careful. The other thing is that this, in some studies also, that this doesn't always work for some women. And there's certainly a risk that you create scarring. I mean, you look at women that get the injections in their lip and these great big lips out there, well, you're certainly getting that kind of filler placed in a very sensitive area, which could lead to scarring, especially if you have a reaction to that.
Is this something, this shot, is something that's new on the market, or?
Well, it's been out for a couple of years now. Actually, in Beverly Hills is where this actually started. Of course. Everything starts in Beverly Hills. But it's been out for a while, but we're starting to see, especially this month, everyone's talking about sex. And that they want to talk about things that are hot and new and sexy.
This is being targeted directly toward women.
Well, yeah, because first off, you're never going to get a man to want to willingly inject himself. But certainly with women, we're actually what we would call the carers of the relationship typically, and we're always trying to sex up the sex life and make it more fun and interesting. And also, the problem is that a lot of women, as we get older, into the 30s, 40s, and 50s, we start to lose sensation down there. And this is one way to hopefully help bring that up. But I caution again that, unfortunately, 80% of women struggle with what's called hypoactive sexual desire, which is a brain problem. It is not a functional problem. I always joke that men actually get plumbing problems. Women, their plumbing usually works fine. It's up here. Sex is about everything up from brain up.
Well, how do we fix up here?
We need testosterone.
Kaylee, it's only a 5-hour show, for goodness sakes.
Most often, it's a combination of relationship, having the right partner, and not you like Dr. Love yourself, but and certainly fixing the testosterone brain problem. It's mostly testosterone function, which helps sensitivity of the clitoris. It helps the opening of the tissue so it's more sensitive, and actually fires the brain desire, which is most important.
There we go.
But if you have arousal disorders, which are actually the plumbing problems for women, that's where this may come in, but it's only about 10–15% of the time.
Well, thanks for coming in today.
Yeah, we really appreciate it.
Yeah, I only took 4 hits this morning.
You know, on Friday, I walked up to my desk and goes, do you know what the G in G-spot stands for? I'm like, I have no idea. And then you rattle off this random word, and he was right.
He's so proud of this, by the way.
Well, every guy knows that.
No, they don't.
Dr. Grafenberg.
Well, the key is how to find it. It's like, where's Waldo?
You wouldn't happen to have a map on you, would you?
Oh, my gosh.
This is something we should discuss after air.